Good morning and welcome to our webcast. Thank you for joining us this morning. Our presentation will highlight the challenges and successes with managing and controlling workers' compensation medical costs. Our presenters this morning will be Dr. Sean Biggs and Sean Tomlinson with Intermountain WorkMed. Dr. Biggs is the medical director for Intermountain WorkMed and has worked in occupational medicine since 2013. Dr. Biggs is a graduate from the University of Utah with both an MD and a master's degree in occupational health. Sean Tomlinson is the sales and development manager for Intermountain WorkMed. Sean has over 30 years of experience with occupational medicine and is a graduate of Brigham Young University. Just a quick reminder, if you should have questions during the presentation, please use the question feature to go to webinar, and we will pause and read the questions during and at the conclusion of the presentation. Also, a recording of this presentation will be available for replay at our website, olyins.com/webinar. With that, we'll turn the time over to our presenters, Dr. Biggs and Sean Tomlinson. Thank you.
Good morning, everyone. Thank you for joining us. And thank you, Brian and Daryl, for putting this webinar to get together for us. I don't know how many of you are familiar with Intermountain WorkMed, but we've been in business as WorkMed for about 35 years. And we have 13 locations from St. George to Burley, Idaho. And this is all we do is just occupational health services. We let our Instacares and our ERs take care of family practice while we focus mostly on occupational health services. So with that being said, I'm just going to go walk through a PowerPoint presentation that I've developed, walk through that, and then talk about some of the benefits to using WorkMed, and then also talk about one of the authorization forms that we have that's a really nice tool for you to send your employees into our WorkMed clinics so that our people know what you'd like us to do for them. So with that being said, I'll go ahead and share my screen with you so that we can go through and this is actually Dr. Biggs joining me. He's our medical director. He's actually in clinic today and will be available for Q&A at the end. And so he can answer any questions from there that you may have. So that being said, we can let him get back to his busy schedule and he'll pop in with us later. Okay. Thanks, Sean. So anyway, yeah, so let's walk into and go to my PowerPoint presentation to share my screen. Excellent, thanks, Brian. Brian, is my screen shared?
Yes, we can see your PowerPoint.
Oh, okay, so let me close this down. Okay, thank you. So at Intermountain WorkMed, we want one of our slogans is we're working to keep you working. We want to be able to take care of your people and do whatever they need us to have done for them, and get them back to work as quickly as possible. So our focus is to provide quality care and do everything that we can to reduce workers' compensation costs and lost productivity. Some of the employer benefits are that we offer a full range of occupational health services and standardized care that meets your company's policies and procedures. We want to do everything that we can to contain workers' compensation costs, reduce and try to eliminate lost time at work while improving productivity. And then we also can organize worksite visits, tours, trainings, screenings, and health safety promotion services from our medical providers. This is something that we like to do. We think it's very important for our medical providers to know our customers and see their employees' work environments so that we can become familiar with our customers and their employees as well. We can offer assistance with compliance with OSHA, DOT, ADA, and then Utah Labor Commission compliance. Our medical director is very well versed in all of the compliance issues associated with these agencies. And then our clinic managers are also very well versed in a lot of compliance issues as well. Workers' compensation is one of the things that we do. We want to help our customers to manage their workers' compensation claims and try to keep their medical expenses to a minimum and their indemnity costs down, and then do everything that we can to keep their insurance premiums down as well. So we want to work with our customers and the workers' compensation carriers to control costs everywhere that we can and provide timely and accurate injury reporting as well. Some of the employee benefits are that we'll do everything that we can to be respectful, compassionate, fair, and objective to care for your employees, and also do what the companies or our customers would like us to do for their employees. We have about 30% of our medical providers are actually OCMED board certified physicians. And then the rest of our PAs and our nurse practitioners are trained by those physicians in occupational medicine. So we know this world very well, and this is all that we do. We're generally open from 8 to 5, with the exception of our Salt Lake office, which is open from 7:30 until 7, Monday through Friday. Some of the services that we provide are, of course, we take care of workplace injuries, but we also do pre-employment physicals, DOT, OSHA mandated, respirator, fitness for duty, return to work, and then FAA certification physicals. And then we do a lot of testing as well. We provide laboratory, pulmonary function, audiometric, vision screening, respirator fit testing, and then all of our WorkMed locations do have digital X-ray machines housed within our buildings. then we do have a large referral system for medical review officer services and federally certified labs as well for drug testing. As I mentioned, we do a lot of drug screening and then also breath alcohol testing for pre-employments, randoms, follow-ups, post-accident, and then reasonable suspicion as well. And we offer online drug screening results as well through our online portal called ISAStock, and I'll refer to that a little bit in the next part of this presentation. So that being said, I wanted to go into some of the benefits to using WorkMed. A few of the free services that we offer are, one, we offer a safety sensitive program, which is a free service to help our customers reduce their OSHA recordables and workers' compensation premiums. So that being said, what we want to do is our primary focus is to provide your employees with extraordinary care. That's something that we have to do, and it's also something that our employers would like us to do. But our secondary focus has to be to communicate with our customers and the employer in order to gather the information and be smart about how we provide that extraordinary care to their employees. Another benefit is that we are the preferred provider to a lot of different workers' compensation carriers, and we work with their people on an hourly basis as well. One of the things that we don't do is we don't use follow-up visits and our physical therapy clinics as profit centers because we are a not-for-profit organization and a company. We want to take all of those hidden agendas and push them to the side to focus on providing extraordinary care for your employees, while at the same time providing that excellent customer service with employers and communicating with them. One of the other services that we provide is our 24/7 continuity of care statewide. And that's a free service that coordinates our 13 WorkMed clinics, generally from 8 to 5. And then, of course, our Salt Lake WorkMed that's open 7:30 to 7, Monday through Friday. We also have our 30 Instacare clinics that can help with that 24/7 continuity of care in the event that WorkMeds are closed and you have employees that get injured. You can send them to our Instacares and they will take care of them generally up until 9 o'clock at night. But we also have 3 locations on the Wasatch Front that are open until midnight, 7 days a week. And those are our Layton Instacare up north, and then our Cottonwood Instacare in the Salt Lake Valley, and then our Provo Instacare in Utah Valley. So pretty much on the Wasatch Front, you can send your employees to our Instacares up until midnight, 7 days a week, without having to pay ER costs. So that's huge. And I think some of you know the benefits to having that available to your employees. The only thing that we would ask is, in the event that you do send your employees to Instacares or ERs, that you would schedule a follow-up visit at WorkMed the very next day so that we can take a look at those particular injuries and make sure that those cases are headed in the right direction and the communication is open to the employer. As I mentioned before, another benefit to using WorkMed is that we are an occupational health services only clinic system. So in the event that your people do come to our WorkMeds, your people are not waiting for people with cold and flu or COVID-19 symptoms. We run what we call well clinics. So we want to do everything that we can to keep from exposing your employees while they're in our WorkMed clinics, and then help our Instacares, or have our Instacares and our ERs take care of people that have cold, the flu, and then COVID-19 symptoms as well. The other benefit to using WorkMed is that we have a free, secure online 24/7 access portal to our computer system, and it's called iSysDoc. And what that is anybody that is in HR or risk management for employers can put in an access request to access their account online, and that way they can go into their account online through our iSysDoc portal and see when their people came in to our WorkMed clinics, what services we provided for them, and then when they left. This is really nice because this is a system that we've had ever since 1995. So in the event that you need to go back and look at things that have happened in years past, that information is readily available to employers through iSysDoc. So, and then the last thing that I wanted to kind of go over is our Intermountain WorkMed authorization for medical treatment form. This is actually an e-copy that I can send to any of our customers, and any of you that would like me to send it to you, I can. But what it is it's a fillable form so that you and any of your HR or risk management people can go right into this form and fill it in using the computer, and then you can either text it, email it, or print it so that your employees can come into our clinics and either show that authorization form to our front desk workers so that they can get your people registered for the services that you'd like us to provide for them, or you can actually text it to them or email it to them, and they can show our people this form via their phones. So what it does is it just lists what you'd like us to do for your employees and who your employees are and who they work for. And then it has a list of our 13 locations on the front. And then I listed our Salt Lake location from 7:30 to 7 in red, just so that employers can be reminded that we are open late or a little bit later in Salt Lake than we are at most of our clinics. And then on the back page, this form actually has a listing of all of our Instacare clinics with the ones posted in red, the hours from 9 a.m. to midnight, 7 days a week at Cottonwood, our Layton Instacare, and then of course our Utah Valley Clinic, which is in Provo, as I mentioned before. And then it has a listing of all of our ERs and our 24-hour treatment centers statewide, so that employers can be reminded that those ERs are available to them and their people as well. So anyway, that being said, that's kind of us in a nutshell. So I think we can probably open this up to any questions, kind of a Q&A session if we'd like. So I don't know, Brian or Daryl, are you ready to go into that Q&A session, or would you like to say some other thoughts?
Sean, no, now's a great time. got a few questions that have come in. One is, can you give us a bit more detail on the safety sensitive program and how that works? I don't know if that's something you could provide a little bit more background.
So our safety sensitive, yes. So our safety sensitive program was mainly set up for construction and manufacturing customers, but it's also available to any other of our customers that need a little bit more help with regards to OSHA recordables. As I mentioned before, we want to make certain that we provide employees with extraordinary care. But in the event that they come into our clinics with an injury, we want to take a look at each individual injury and say, does it need to be an OSHA recordable, or is there any way that we can keep it first aid only? We want to provide that extraordinary care to employees, but we also want to be exercise that secondary focus to our employers, to listen to them and talk to them about their employees' work environments, their work descriptions or their job descriptions, and do anything that we can in order to get those employees back to work as quickly as possible. When 100% of the research tells us that the quicker we get employees back to work, the quicker they heal, we want to do whatever we can in order to get employees back to work at full duty as quickly as we can, and make sure that them and their families are able to draw a full paycheck, while at the same time doing everything that we can to provide that extraordinary care without it hurting the company and raising workers' compensation premiums and costs. So I hope that gives you kind of a good background on our safety sensitive program.
Indeed, yeah, and just to clarify, what employers need to do to enroll in the safety sensitive program?
So in order to enroll in that, I would need to be contacted, and then I would need further discussion with employers to decide if in fact that safety sensitive program is something that they would like to enroll in. And then if it is, then we would flag their account as safety sensitive and make sure that that's followed by our people when they come into our clinics.
Okay, great. Got a few more questions. One was, what's the most common claim type where you see the safety sensitive program being really beneficial? Is there one in particular that stands out that you often see over, I don't know if it's over treated, where it doesn't necessarily need to be recordable?
Yeah, I would say that sprains and strains and then bruising are probably the most safety sensitive injuries, in that what we don't want to be doing is we don't want to be prescribing 800 milligram ibuprofen. One, because it doesn't really make medical sense, because if an employee comes into our work med clinics and they get, they're seen for an injury, their pain may peak about 2 days later. And then what do? Do they start cutting those 800 milligram ibuprofens in half or thirds or quarters? So at that instance, our medical providers would recommend to the employees that they take either ibuprofen, acetaminophen, or aspirin, whatever works best for their pain relief, as needed. So we want to just be smart about how we provide that extraordinary care without making things recordable if they don't need to be. Does that make sense?
Yes, yeah, that's Perfect. Another question. Does WorkMed have an industrial hygienist on staff as part of this process?
We do. In fact, I know that we have one for sure, and her name is Dr. Carla Olson. She's an industrial hygienist, and she's actually also board certified in occupational medicine. So we have at least one, and I can't remember if we have others, and I don't know. Dr. Sean Biggs, are you on by chance? He may or may not be able to answer that further, but we do have at least one that is on staff that's available to our customers and employers to get any consultation from. Yes.
Okay, and then just as a follow-up to the industrial hygiene question, do they do work, field work, or is it primarily in the clinic in consultation that way, or do they go on site to projects?
It's mostly in clinic, but we love to get our medical providers on sites. So whether that be a construction project and or work environments, they are available to give consultation for safety programs and also industrial hygiene. So yes. And so those services would be provided at no charge up until the first hour. Does that answer your question, Brian?
Yes. Yeah, that's
good.
That's great. Another one, they're looking to set up a drug testing program. Are you the best person to reach out to coordinate setting that up?
Yes. Yes. Yeah, and I can send that either if you want to send me that person's contact information, Brian, or any of your people that would like me to follow up with them, I can reach out to them, and or you can get them my contact information, either way.
Yeah, I can do both those. And we'll also, in addition, when we post this webinar, we'll send an email out that will have both Sean's information as well as that form. I know several have been looking for a copy of that form you had up earlier, so we'll get a copy of that and post that as well.
Excellent. Yeah, so I can provide you with both my contact information and then Dr. Biggs' contact information, as well as the authorization form. Does that sound good?
Perfect. Let me just make sure we addressed all these other questions. A couple more questions quick. Does WorkMed offer hepatitis B vaccine services?
We do, yes. We offer the testing for hepatitis, and then we also offer the vaccines as well.
Okay. And then one more, does WorkMed actually provide reasonable suspicion training? I know many may receive that through their workers' compensation provider in-house, safety team.
We do, yes. We actually work a lot with a third-party administrator by the name of Blue Line Services, and they can provide that training. And we usually do that pretty much once a year, or whenever our customers need us to do that. And what we'll do is generally set up a seminar, and it has been in person in the past, but we can certainly do it online as well. So if any of your clients would like to contact me, we can certainly set up that training. and get those people trained so that they're able to see the signs of reasonable suspicion and then figure out how to do the drug screening from there. Yes.
Very good.
I do have Dr. Biggs here. He just kind of popped in, and I'll ask him the question that you asked me, Brian. Do you know if any of our other medical providers are industrial hygienists, with the exception of Carla Olson?
No, nothing at all.
I think she's the only person that we have on staff. So she's definitely readily available for any consultations or questions that your policyholders may have.
Okay, excellent. And they can reach out to you to connect with her? Okay.
Yes. Yeah.
Very good. Well, I think that I think we've answered all of the questions. I don't know if you have any other comments, Sean, or Dr. Biggs has any context you'd like to add on the topic.
Well, this is Dr. Biggs. I just popped in and I'm happy to answer any questions or kind of anyone could like to get a sense of what we as physicians are focusing on here. I think Sean probably went over a lot of that with you on keeping first aid visits first aid when it's appropriate, of course, and then no missed days work. We hardly ever have to have a missed day work in a visit that we have here for an injury, but if there's anything in specific I can answer for you, I wasn't here for the whole presentation to see if there were other questions, but.
Yeah, I think Sean's done a great job addressing the questions that we've had come in. So I think it's a terrific resource, and especially the safety sensitive program. I know there's tremendous benefit to incorporating that into your overall health and safety approach as an organization. So I'm seeing quite a bit of benefit there from utilizing that approach to minimize recordable incidents when possible. So thank you both for your time this morning and for the excellent presentation. And just by way of reminder, a recording of this presentation will be available at our website, and we will also send out a link to those of you who've registered with a copy of that recording, as well as Sean's contact information, as well as that authorization form he referenced in his presentation. And with that, we hope you all have a very safe and healthy and happy holiday season, and look forward to getting together again soon. So, thanks again, and take care, everyone.
Thank you very much, Brian.